I'm Annalise Cochran. Thank you. I'm Annalise Cochran. I'm the Executive Director of the American Institute of Dental Public Health, and I am the facilitator of this learning collaborative. So thank you for being here today and spending some time with us to learn and share about LGBTQIA plus oral health. So I do have some slides prepared, although we typically keep our agendas a little bit informal, just across all of the open learning collaboratives and NRTs. So while I do have some slides here, I just want to name at the very beginning that the intention is to really keep this conversational and for the group to kind of lead where we'd like to go next in our time here together today. A little bit of housekeeping, and I'm just going to do my own housekeeping as I notice that my name does not include my pronouns for an interesting reason. But one, the session is being recorded so that folks who can't make it today can review the content. And then two, we encourage everyone to add their personal pronouns to their Zoom name. Adding personal pronouns to introductions is also highly encouraged, and we want to make sure that you feel included and affirmed during our discussion here today. In case you are new to the LGBTQIA Learning Collaborative, this is a quarterly learning collaborative facilitated by AIDPH in partnership with the Oral Health Progress and Equity Network. So as a little bit of background, this learning collaborative was started in 2020, a really exciting year for virtual learning. And then it was conceived in 2019 when we realized as part of our ongoing strategic discussions and open that there wasn't a dedicated focus to LGBTQIA oral health. And so we took that time to really consider what we needed to do to form an NRT or learning collaborative, and also where the gaps were throughout the network and some of the holes that we could potentially fill through this learning collaborative. Since that time, Open has now been supported or is being supported by CareQuest Institute for Oral Health. And so Open was always connected to CareQuest, and now CareQuest is serving really as the backbone and infrastructure support. And that's been ongoing since late last year and early this year. As a brief reminder, this is sort of the format of our learning collaborative and how we are implementing it throughout 2023. It includes quarterly meetings with a focus on advocacy and education campaigns. The group gets to determine what those campaigns are, what the important topics are that we tackle as a team. We also use this space for personal and professional growth to learn more about LGBTQIA oral health, and we, as advocates and allies and accomplices, can promote growth in our profession and awareness about the unique needs of LGBTQIA plus oral health. Lastly, we use this space for community leadership, meaning if you are a cisgender straight person and you want to ensure that you're learning from community members, we prioritize community leadership here, and we also ensure that we're raising community voices throughout this discussion. So these purposes and goals were determined by the group earlier this year and part of last year. So as a reminder of what we designed and agreed to for sort of the purpose of the learning collaborative, it is one, to identify, create, and amplify resources for community education. So this group typically stays in the amplify space. We don't usually stay in the create space because that can be a lot of work. But identifying and amplifying resources is something that this group has done pretty successfully in our track record together. Two, developing strategies to engage the broader network. Examples of strategies have included webinars, Take 20s, promotion of different policy and advocacy opportunities, etc. And then lastly, we use this group to identify, synthesize, and disseminate policy action items or information. And so this has looked like a lot of different things. We typically stay with policies that are relevant on the federal level, mostly because the state level policies advance very quickly, and it's very difficult to stay up to date on potential policies that we may want to call attention to. So traditionally, this policy space has really been, an example is looking at the Equality Act and calling attention to ways that oral health advocates can be involved in supporting the Equality Act and talking to legislators or other important policy decision makers about the importance of that policy. So now that I have shared a little bit about the NRT and about myself, I'm going to stop sharing my screen and encourage folks to share a little bit more about themselves. So our share out request today is we'll just go popcorn around the room, name, title, organization, and then the share out question that I had today is, why is LGBTQIA oral health important to you? So Francis, you're on my screen. I'll just ask, I'll ask you to share first, if that's okay, and then call in the next person.
Sure. Hey, everybody, I'm Francis. I am new to this team as a support this year, but I have always had mad love for the LGBTQIA community. I live in Long Beach. I've been in Long Beach, California for the past 10 years or so. I've been a bridesmaid in more gay weddings than straight weddings. And I have just I'm interested to learn more about how to be an advocate for this community, just because so many of my friends and people that are in my community, learning how to best support them. So thank you.
Francis, do you want to call in the next person?
Oh, sure. Christina?
Hey everybody, I am Christina Lusk. I'm a communications specialist at AIDPH. And yeah, this is important to me because addressing all health disparities with marginalized groups is important. And there's a large intersection between the LGBTQIA+ community and the disability community, which I'm a part of. So I've always enjoyed being able to work with those. And I'll call on Grace.
Hi, everybody. Grace Lynn. I am the Director of Communications with AIDPH and formerly with Open in a similar role. My pronouns are she, her. And why I'm interested, well, it's a focus area for AIDPH, one of our communities of focus. And I get to interact with a lot of the teams here doing the research and advocacy pieces. So as a communications person, working in social justice, social marketing, systems change space, it's just really important for me to be engaging in work that I feel like is making a difference. So happy to be here, happy to see you all, and I will pop it over to Emma.
Hi, I'm Emma Larson. I use she, her pronouns, and I'm the marketing and communications manager for Apple Tree Dental. We're a nonprofit critical access dental organization based in the Twin Cities, and I am located in St. Paul, Minnesota. And not only am I part of the queer community, I'm bisexual, but also I get to see firsthand through that community and also through my job the disparities that exist in oral health, and particularly in these marginalized communities. A lot of my friends don't have access to dental care. So it's just really important to me to make sure that not only are we addressing oral health disparities, but that we're paying special attention to these communities that might be facing even more barriers to care and barriers to equitable health. I got a popcorn to somebody. Alicia?
Yeah, Gonzalez. I'm with the Oral Health Forum. I'm a project coordinator with the program and in all kinds of communities. So I just wanted to try to bring more advocacy to populations that usually wouldn't get assistance, especially Hispanic, LGBTQIA plus communities in Chicago. And I'll pass it on to Helene.
Hi, everyone from hot Massachusetts, although I shouldn't complain because I know some of you are in Texas and other places where it's really hot. So I have retired from having created the first HIV dental access program when the Ryan White Care Act was passed and Boston was among the first 15 cities to be funded. And I've always worked with vulnerable populations. I'm currently a consultant, dental director of the New England AIDS Education and Training Center. I've been their dental director for 25 years and been with them since AIDS Education and Training Centers were created in 1989 as faculty. So I think, from that type of background and from personal, family, friends, a variety of reasons, I have a great, interest in this. Access to oral health care is very important. We bring that up in all the coalitions I'm on, and I know growing up, it was more of a luxury in our family than something that was a necessity. It was more emergent care than routine. So I can truly understand the obstacles. Anyways, I think I've said enough, so I will mute. Don, is there anybody left here? I can't quite see the whole screen.
I think it's just me. So I
Well, then
think
you, Sarah, I'm passing the torch on to you.
thank you. I am Sarah Key. I use she, her pronouns, and I am the executive administrative operations. I forget, executive operations and admin for AIDPH. Fairly new to the organization. I think it's been about 3, maybe 4 weeks. And I'm located in Chicago with my wife here. So I think LGBTQIA oral health is important to me because I am queer and because I have teeth. And then also I have a background in LGBTQ advocacy work, specifically with the intersection of LGBTQ youth homelessness. So I think that our community has a lot of intersectionality within it, and we are more likely to experience disparities in a lot of different social and health factors, and oral health is a huge part of that. So I'm happy to be with AIDPH, and I'm really happy to be here today.
Amazing. Well, thank you, everyone. Thank you for spending your time with us today. We have about an hour of discussion or longer if we need it. But what I thought I would do is, aside from getting to know each other and introductions, is share, I guess, a success or an excitement that came from this group. I'm dropping it in the chat. And where I'd like to spend some time today is actually sharing out the results of a recent research brief released by AIDPH. And that was because this group in the summer of last year helped to define research questions and research priorities for LGBTQIA oral health. And then AIDPH took all of that information and put it into a survey that we sent out to oral health professionals to assess essentially comfort and knowledge and awareness and a few other factors around LGBTQIA plus oral health. And so the work of this group really helped to shape and define that survey. And now we've been able to publish those results. And so I thought I would just sort of spend a little bit of time today, not going over all of the results, but hitting some of the highlights and getting some feedback and input from this group on next steps or insights or anything that may have resonated with you all. Followed up with, now we're sort of here a year later, and that we are looking to do more research in the fall specifically on dental education. And so we'd love to follow the same format that's been successful with this group, which is discussing options and opportunities and considerations for those future research areas and gaps that we may be experiencing. So I did prepare some slides. Let me call those up. And so these are just, this is, I guess, sort of a reminder here of why AIDPH is facilitating this NRT, which is it's LGBTQIA plus people and their oral health are part of our 4 core communities of focus. So AIDPH does research, we create educational opportunities, and we also support advocacy within these 4 core communities of focus. Which is why we find this learning collaborative so important and value the feedback of the members because it's really critical to the work that we do. I'm just reminding everybody a little bit about our community engaged research model. AIDPH adopted this last year, or maybe the year before, and it really is an intention to have communities at the core and at the center of all of the work that we do, informing and partnering authentically within each of those core communities of focus, which is again why we facilitate this NRT and ensure that we're relying on community feedback. And then as part of that community feedback loop, we're taking the results of research, serving as the technical expertise, we're putting the research results back into the community that is directly impacted. And so part of reporting out results that were created by this group and informed by this group means that we're really looking for ways to implement this within the community of focus. And in this case, it's within LGBTQIA plus people. Okay. So as a reminder, this group helped to develop kind of the purpose and some of the goals of this survey that was disseminated last year. We did kind of a listening session about what folks felt like was important under the topics of LGBTQIA plus education. And education, we took that kind of broadly. One, dental education, what do students who treat LGBTQIA plus people, which is every student, what do they need to know about effective patient healthcare delivery and personalized healthcare experiences that are culturally responsive to queer people? And then 2, how are we considering dental education environments for future oral health clinicians? Are environments and institutions themselves creating an inclusive environment where queer people feel like they belong, where they can thrive, and that their lived experience is honored and authentically represented in inclusive spaces? And then lastly, we really just wanted to understand how oral health professionals really understand and acknowledge how queer people should be considered in the patient treatment space. We typically hear a lot, this came from a survey that this group actually did maybe around 2020 or 2021, where we did kind of a really quick needs assessment. And it was very common for us to hear in that survey that everybody clinicians treated every patient the same. And that's not true. I like to call that the rainbow washing, kind of like whitewashing, color blindness, right? Like white people don't ever see color. We treat everybody the same. We know that's not true because that's not how human beings are designed. And I think that's the same thing with patient care. Every patient, we see differences in people, and it's not about saying that we don't see differences, but really it's about personalized treatment and ensuring that we're providing an inclusive environment for all people, including queer people. So some of the important results that I wanted to point out as we went through this discussion today is number 1, among our community of respondents, we had a pretty varied representation of the type of people who responded to our survey, but almost a quarter of them were clinical. So as we look through insights here, we're just acknowledging that we did get a pretty good chunk of both educators and clinicians. Again, I'm just cherry picking some insights here, so please refer to the broader publication for more specific details. But this figure was important because it really talked about, number one, getting to the grit of things, which is how respondents felt in terms of comfort levels with straight people versus people who were gay or bi or sexually fluid versus people who were gender diverse. And so what we found was that by and large, people were comfortable with straight folks, which was no surprise to us. People were comfortable, more or less comfortable with gay, bi, or sexually fluid adults, but that comfort levels, both personally and professionally, tended to decrease around transgender people, and decrease the most around transgender, non-binary, or gender diverse youth. And so our key takeaways that we got from some of this data, again, boiling a complicated analysis down to a couple of key takeaways, is that in general, oral health professionals felt, a high level of comfort treating LGBTQIA plus people. We're talking about results that were still more than 70%, comfortable. However, we understand that, gender diverse people were among the least or the lowest levels of comfort, both personally and professionally, when assessing oral health professionals. Older respondents in particular, those that we would assume had the most established experience in dental public health, have been working in the field for more than 10 years, were actually the least comfortable with transgender youth and adults. And so kind of an interesting result that we found, and perhaps something that we can discuss as to maybe why or how we could tackle that around strategic recommendations. Another result to highlight here was sort of the perception of support for LGBTQIA plus people in the educational environment. So again, when we were looking at education, we looked at our oral health professionals and clinicians in particular, specifically, so people who are attending dental school or dental hygiene school, are they getting the information that they need to effectively and culturally treat LGBTQIA plus patients? And then if you are a queer identified person receiving education in those institutions, do you feel affirmed and included in your educational environment? And so some of the questions that we asked related to those two topics include whether or not your school encourages discussion around LGBTQIA plus topics, whether or not your school considered LGBTQIA plus issues as a core aspect of clinical training, and whether or not your school is preparing students to provide care for this community. And so as you can see, there was a lot of variability. But if you look at the darkest bars, which are strongly disagree and disagree, where we found the highest levels of disagreement was where schools were considering LGBTQIA plus issues as a core aspect of educational curriculum, meaning there was a lot of variation as to whether or not schools and dental education environments were actually putting this type of critical content into lectures, into patient care delivery, experiential learning. And so that was a major concern, seeing that there was a lot of variability as to whether or not students would be effectively exposed to this really important content as part of core dental curriculum or dental education curriculum. So those were the key takeaways from the questions that we asked around dental school curriculum. And I kind of just actually said all of those things. But really an investment in inclusive educational curricula kind of created this ripple effect that we saw, in that when there was more inclusion and affirmation in dental schools, when people perceived that in dental schools, then they also perceived more inclusion all the way around, personally and for patients. So again, this is not all of the results that we found. I just don't want to spend all of the time going through that. But some of the recommendations that we pulled from here were that we believed increased educational support was paramount to supporting more effective and inclusive environments for queer people who are attending dental school or dental hygiene school, and also ensuring that patient support was more viable by ensuring that educational institutions were engaging in strategies like creating policies, where institutions have very explicit policies about how they will be inclusive and affirming for LGBTQIA dental educators and students, and that they will be enforcing those policies too. So a lot of schools may have these policies on file, and how they are enforced varies too much to actually be effective. Second strategy that we recommended in this area was to expand curricula. Dental schools should create more comprehensive education and should, again, apply that consistently for each year and ensure that clinicians are being trained in how to provide personalized care to everyone, but in particular to the LGBTQIA+ population. I chose to highlight this result because this is something that the NRT has done quite a bit, and one of our main priorities, which is to identify and amplify resources. So I thought this would be a helpful one to talk about with the group, because that's something that we've been able to do pretty effectively, which is increase awareness, and doing that by extending resources more broadly throughout our community. A lot of resources that we have are not designed for oral health, but could certainly be applied in the oral health space. But that one call to action in particular was in expanding knowledge around queer people generally, but transgender people specifically, given the lower comfort levels around that particular population. We also talked about establishing clinical standards and how few clinical standards actually exist for queer people, but transgender people specifically around oral health, and how we should just be prioritizing research and resources to give people more information, because when people have more information, their levels of comfort will probably increase. Okay. So I'm going to stop here and hope that I've given us enough information to kind of go through some discussion, because our intention here is to get as much feedback as possible from the group on where this research you feel like we could be talking about it, disseminating it, maybe how it resonated with you, anything that we may have missed or could explore further. And so I will just pause, and I will also mute, because I'd love to hear from the group. And I know there's some comments in the chat too, so I want to make sure that you have the space to discuss.
Is there a training or curriculum available for oral health regarding this population, or not? Or one that's understood? So
You bring up such a great point, Alicia. The resources vary. So I think there are a lot of resources available on what I would probably consider to be kind of basic cultural competency for queer people. And even if it is basic, that doesn't mean it's not necessary. So things like terminology, understanding terminology, understanding kind of some cultural aspects of the queer community. I think all of those things are readily available, and they're not specific to oral health, but they certainly support more effective oral health. The places where we don't have as many resources that are specific to oral health is that clinical care component. I like to direct people to Fenway Health. They have a lot of really good resources there. They don't have really that many for oral health and dentists, unfortunately, but they have a lot of really great resources that could potentially be adapted into your clinical situation. But you know what, Alicia, I like that you brought up earlier wanting to consider intersecting identities around the queer community. And so one thing that I think we're probably lacking, aside from oral health resources, is also culturally competent to different races, genders, or ethnicities. And, you know, I think that's, you know, do we have a lot of multilingual resources? Probably not. I think there are lots of gaps that we could potentially tackle. I'd love to hear the group's feedback on that.
I am not a clinician myself, so I'm not super familiar with the you know, the curriculum that is being taught at the different levels, but I imagine that one of the biggest obstacles for implementing any kind of standard curriculum regarding the LGBTQIA plus community is going to end up being the political environment in that state. You know, we've found here in Minnesota that you know, while we have made leaps and bounds in certain dental related, you know, progress points, for example, we were one of the first states to implement dental therapy. That is, you know, that was extremely contentious. And we actually, I've heard it was more contentious than the discussion on abortion. So there's a lot of control that people want to have over the dental field. That we had backlash from the dental association and everything, just for adding another provider to the team. So I think if you start to talk about, you know, adding something to the curriculum, that's going to be a big hurdle. It's a necessary hurdle, but I think we're like, it's going to become sporadic at best across the country. You're probably going to see a lot of states like Minnesota leaning into it, and then you'll probably see a lot of states leaning out of it or having some backlash to it. That's just my thought process.
I love that you highlighted that, Emma, and I'm curious how folks may see the role of this group and this learning community, knowing that some states like Texas, where I came from, is proposing significant barriers, and how we can sort of at this national level, I don't have any answers to this, I'm just curious, how at the national level we can be more supportive, knowing that the local level can be really hostile.
And at least my head was going, you know, hearing both Alicia and Emma's comments. You know, we at AIDPH, we think about this research, right? And we have this and we've shared it, and you're raising like, oh gosh, wouldn't it be great if, right, we had some additional resources, one of those perhaps being, you know, a curriculum or advocacy materials to help states make the case, or, you know, so, and we do our LGBTQIA plus oral health week. Christina, what month? Help me. That's in the fall, right? October? Yeah. So, but anyway, in a few months. And so like I keep thinking about, you know, stepping stones to that month with this information. And if this group might be interested in, you know, grabbing a piece of it, you know, and between Open and AIDPH, if there's a way we could, you know, center our activities in that week. The awareness piece is so huge, and everybody still needs a lot, I think, of support and just general understanding of the community. But this education piece feels really interesting. Wonder if there's a way we could partner to do something that would help folks with that advocacy and creating more access to resources. And Emma, thanks. You've put something in there though, in the chat.
Yeah, I'll just say again, with dental therapy, Apple Tree Dental has gotten funding in the past to create like video content highlighting why dental therapy is such a big deal here. And I know that's been shared across state lines, and so I think that video content is a hugely important piece of the puzzle, because it's a quick and easy way to share stories and get that in front of people and have it be shared widely online. That's just one thing that's worked for us.
I just wonder too, as the network, like Francis, you might be able to speak to the Hill Day and the focus, but that's an advocacy opportunity too. And I don't know if open, if there's broader support than we see here, around the table today, but kind of using the power of the network to leverage the topic a little bit more. I don't know if there's any interest in that space, network space.
Yeah, I definitely think that there would be broader interest. I'm also considering like we had a learning community around justice, equity, diversity, and inclusion. And also recently the Health Equity Super NRT, they launched the Anti-Racist Organizations Workshop Series. And a lot of the work touches on cultural competency or cultural humility, and understanding kind of that spectrum. But as far as, thinking about educational materials and resources, there is a lot of intersectionality between populations, and I think just having, I don't know if it would be like a continuing education type of thing, but just considering all different parts of your practice and people that you see. I think that there's a lot of interest and engagement across the network. So if we wanted to try to figure out how to harness that and promote, I think lots of potential.
Well, I think we're on the topic of brainstorming and ways that we can draw folks in. If it's okay, I will transition us to the next topic because, as I mentioned earlier, the goal is to continue to get feedback from this group and input around future directions for our research. So AIDPH actually put together a really quick proposal as part of a learning collaborative that we are in with other national organizations. And ensuring that some of the research that we've already done, trying to get more funding to call attention to inclusion and dental education in particular, and inclusive patient care be prioritized for current and future dental clinicians, right? And so we have an opportunity to actually evolve this research. We were given an opportunity to potentially evolve this research, and how we've conceptualized this is creating kind of a compendium of affirming programs. So seeing what programs are already doing and what's already working in dental schools and disseminating that more effectively. So it's almost like creating a best practices compendium, and seeing what other schools can replicate more broadly across, the dental education network and spectrum, but also holding listening sessions and focus groups from students and faculty in particular, and saying, how can we create more inclusive environments? And what do you think is missing from more effective patient care? So we are planning on starting this research in the fall. And before we do that, we are really taking a hard look at input, particularly from our core communities of focus. In this case includes LGBTQIA+ people. But really, we want to ensure that we're approaching this methodologically sound, that we are choosing topics to consider for focus groups that are really important. that we can partner with schools that either one could use our help and support, or two are maybe one of those high successes and are already have inclusive practices and are doing a really good job, that we could amplify their efforts. And then maybe any other special considerations that we haven't thought of that we could leverage this model toward when we look to implement this in the fall. So I'm certainly not cutting off conversation here. And in fact, I'm really looking for a lot of feedback and input around how we could advance the research, build on it, and then perhaps use it in this model where we're kind of creating these focus groups. So I'm going to stop sharing my screen and ask again, what could we be doing? What do you feel like we should be looking at in terms of topics and partners and methodology? And again, if you have any programs or resources that should be included, we're also looking for that too.
So just a clarifying question. So obviously this group can make recommendations, I would think, but what's actually enforceable on the post or on the predoctoral level in education?
Yeah, that's such a good question that I have I'm trying to not have a long-winded answer toward. So schools have some flexibility, and then there are also requirements for pre-doctoral programs to teach certain types of curricula from CODA, which is the Council on Dental Accreditation. And basically CODA, which is run by the American Dental Association, says these are the core competencies that you have to have in your programs, and this will be how they're assessed, right? Technically, CODA has inclusion and equity as part of their core competencies. Do they enforce it? I could argue an absolutely not on that. So maybe some action items are both at the national level and the regulatory level, and at the individual school level. If I were to answer that, I would say there's probably opportunity to consider action items at all levels. And I think there is flexibility. At least there's probably more flexibility at the school level.
So how difficult would it be to, recommend to CODA that they absolutely should be enforcing their diversity, equity, and inclusion policies?
Oh, it's not difficult to recommend it. I don't know if they'll listen to us, but I'm all open to sign-on letter. AIDPH has signed on to letters like that before with CODA. I'm not sure CODA's been responsive to it, but this group could certainly consider that as a call out or an action item.
I think I can't speak for our organization as a whole without talking to leadership, but I would imagine that would be something that we would be on board for.
Maybe that's something we could also call attention to during our LGBTQIA Oral Health Week in October. Since we specifically set up that time to draw attention and awareness outside of Pride to back to queer people. And we put together a pledge to sort of say, this is how you can be authentically committed to LGBTQIA oral health. And maybe it's one of those things like, this is how we follow up on our commitment and our pledge is by advancing more action toward the governing bodies.
I think that would be good. I think that whenever there's like that kind of public, public campaign advocating for somebody or some population, having that back end work and saying like, this is what we're doing, that's going to put a little bit more teeth into it.
what else comes to mind? Really at any level. Again, we're looking at individual person level, although I can argue that's probably not where we're trying to create change. We're looking at institutional level. And then, as Emma suggested, up to regulatory bodies and calling attention or action there.
I don't want to do too much speaking, but I guess one thing that we're trying to do also is implement a cultural competency committee at our organization and, open it up to literally everybody in the organization who wants to participate in that. And, with the goal of having people representative of a variety of communities, including the LGBTQIA plus community, including people of color, including people from, disparaged economic backgrounds, things like that. So that's something I think would be helpful for businesses and organizations that provide dental care, would be to ensure that they are getting feedback from ideally colleagues in that community who have both the experience of seeing how their policies are implemented in the field, but also can give feedback on what best practices could be. And now I'm going to mute myself.
No, I wish you wouldn't. Nobody has to mute themselves at all. I want to say that's actually a wonderful idea. One thing that I put in the next slide for upcoming opportunities is that AIDPH is forming a community advisory board. So it's a very similar concept, Emma, where we want to ensure that there's authentic representation in all of our core communities of focus, and even marginalized communities that are outside of our focus but should be represented, to ensure that we as an organization are promoting inclusive research and educational programming and all of the ways that we don't understand what we're doing wrong, that we can fix those things. So I love that idea. And one thing I was going to say is that AIDPH will be recruiting for that in the fall. So we hope this group will help us, disseminate those applications. But, it's not a new concept. You're right. Any organization, big or small, can create that type of advisory committee, or however you want to frame it, as an action item or next step on inclusion.
Yeah, I think that the reason we ended up doing it was because while, anybody can go to HR or wherever and say, hey, these are certain changes I'd like to see made, it's got a little bit more body to it when you have it as an official recommendation from a organization sanctioned committee, then there's okay, this committee has recommended that action. So
I like that.
Emma, when you said that about action, I was playing around with A words over here and, thinking of the three-legged stool and what this what this, group could do that had action and advocacy and awareness, right? Like, what would be some pieces in each of those buckets? And I'm not sure those are the buckets. And then I was trying to do an acronym in it too, like action, collaboration, and an ACE. We could anyway, it would be really fun, Annalise, like with what AIDPH is doing, what Open's doing, Emma, what you're, it just sounds like, yeah, there's something kind of bubbling up that could be leading towards things that we would do together, as part of that Oral Health Week that would engage, others in specific things. And Annalise, this study piece too could be fantastic. I don't know what the timing is of having the compendium ready, but that's a resource, right? That would be awesome to make available.
Elaine, did you want to hop in?
Sorry, I'm going back and forth because Congress is trying to eliminate the Ryan White program funding that's been in place for 33 years. So talk about vulnerable populations. Anyways, what I wanted to mention, and I'm sorry, I'm going back and forth between two screens, is that the Northeast Caribbean AIDS Education Training Center recently did a brief presentation on this with testimonials from about 4 or 5 different individuals who agreed to, appear in this webinar and discuss their oral health experience. So I think you would find them at neca.org, Northeast Caribbean AIDS Education Training Center. If anybody knows Steve Abel, I think he may have been part of this group at one time or still is. He's the one that put that together, and it's very compelling.
Thanks for that resource, Helene. If I'll find it and send that out to the group, but I appreciate that. And to your earlier point, I did actually bring up an email regarding HHS cuts, and I had planned on sort of wrapping it up as just a awareness piece, but I can certainly do that now for the group, which is, at the federal level right now, they're debating the president's budget, right? So the president requests a budget, and that's part of the omnibus bill that then gets debated during the appropriations process. And so right now, the House has passed its version of what the budget should be. And in that House passed version, there are significant cuts to the Ryan White program, which has traditionally supported HIV/AIDS education and patient care, but it also extends to a lot of other LGBTQIA healthcare too. It's certainly not just AIDS, and it started that way, but that's not what it supports at this time. But they're suggesting a $238 million cut. But across the board, they're actually promoting cuts to the CDC and the HIV STD center and activities. They're suggesting a $3.8 billion cut to NIH, a $32 million cut to the Minority HIV/AIDS Fund. There's an 18% overall cut to the CDC and a 12% overall cut to HHS. So this affects a lot of healthcare, particularly minoritized populations and their healthcare. So this is just the House bill. Again, a reminder that that's not final, but it is an awareness piece so that folks understand that there could be some really devastating cuts. And if you feel like that is not okay with you, there are certainly opportunities for you to speak to your leadership, to your members of Congress, and express how you feel about that.
So it's actually, still in subcommittee, as you know, and that's why AIDS United, National Alliance on HIV, AIDS Education and Workforce Development, a number of groups. If you go to APHA, whether you're a member or not, Georges Benjamin did release a statement. It's on the website about this, and on the Dental Public Health listserv, Annalise, which you get there. Bob Wyant, myself, and then David Resnick shared information breaking down. And in David's, he broke down all the oral health impacts. And in Bob's, there are links to what the subcommittee's looking at, their amendments. And in mine were links to other organizations. It's, they're coming after just a variety of groups. One thing of significance, given that we're allegedly, I'm not going to say out of the woods with COVID, but on a downswing, depending on what happens in the fall. They also plan to eliminate the EIS program at CDC, which is the Epidemic Intelligence Surveillance Program. And they're the ones with the boots on the ground and, you know, the holes in their feet, kind of doing the work in tracking, you know, epidemics, pandemics, foodborne disease, and everything else. So there are multiple threats to public health in this. And that I should stop my advocacy rant, but it's part of my personality.
Yeah, thanks, Aline. I appreciate that. And I think that was a good segue too, to just sort of closing out today, which the last thing I had was Hill Day. So Open is having a Hill Day in the fall. It is a virtual Hill Day. So if you are interested in continuing any advocacy pieces, we just announced, I'm also the facilitator, co-facilitator of the Policy Learning Collaborative for Open. So we just announced the slate of different things that we'll be talking about. It includes veterans, it includes some Medicaid and Medicare. It also includes advocacy around individuals with disabilities. And so there's a lot to work through. And I will just say too, as you're there, if you choose to participate and you're talking to a policymaker, you have the time to talk about the things that are important to you as a constituent. So if that means you want to talk about funding for Ryan White and the importance of what that means to your community, you have the opportunity to do that too. So how this works is when you register, one, you'll be prepped closer to the date about policy asks. So you certainly won't be going into it uninformed or unprepared. Two, you will be set up with meetings with legislators. So Open is working with a third-party company who manages all of the meetings. So you'll be given a slate of your local, quote unquote, local legislators that you'll be meeting with associated with your state. So these are not state legislators, these are federal legislators that represent your state. So you'll get more information closer to the date, which is in September. So just stay tuned if that's something that you're interested in. It's really easy to register. Francis put the link in the chat. So we hope you'll take advantage of that if that is of interest to you. And so with that, we're right at 3 o'clock. And I think it's fine to close out for today, but also asking, is there anything from the group that we want to talk about before we do? Okay, hearing none, I just want to thank you all for your time. Oh, thank you, Emma. Yes. Okay, perfect. Yeah, anyone can register for it. So thanks for that flag. I thank you all for coming today, for your time, attention, and thoughts and feedback. It was certainly valuable. And we'll see you again at the next meeting. Take care.